Pediatrics is the branch of medicine that deals with the care and development of children and the diagnosis and treatment of diseases in children. The medical assistant must develop the skills needed to assist the physician in the care and treatment of children. The medical assistant must establish a rapport with the pediatric patient. If the medical assistant gains the child's trust and confidence, the child is likely to cooperate during an examination or procedure. During both well child and sick child visits, the medical assistant must measure the child's weight. The weight of a child is used to determine nutritional needs and the proper dosage of medication to give the child. The length or height is also measured during the visit. Length is the measurement of the child in a supine position, while height refers to the measurement of a child in a standing position. The medical assistant will show you how to measure the weight and length of a 4-month-old pediatric patient using a pediatric balance scale. Before proceeding, sanitize your hands. Greet the infant's parent and introduce yourself.
Hi, Mrs. Jackson. My name is Kim. I'm going to be your medical assistant today.
Identify the infant and explain the procedure to the parent. Depending on the medical office policy, ask the parent to remove the infant's clothing and put on a dry diaper, or remove the infant's clothing, including the diaper. The weight of the infant is usually measured first. Unlock the pediatric balance scale and make sure there is a clean paper protector on it. The paper protector prevents cross-contamination between patients. You must first check the scale to make sure it is balanced. The weight will be inaccurate if the scale is not balanced. The scale should be balanced with the paper protector in place to compensate for the weight of the paper. The upper and lower weights must be on 0, which is all the way to the left. If the scale is balanced, the indicator point will rest in the center of the balance area. Do not weigh an infant with a wet diaper, as it could increase the weight considerably. A dry diaper has a minimal effect on the weight of a healthy infant. Growth charts for infants and young children base their percentiles on the weight of the child without clothing. Gently place the infant on his back on the table of the scale. Place one hand slightly above the infant as a safety precaution. Balance the scale by moving the lower weight to the notched groove that does not cause the indicator point to drop to the bottom. Make sure that the lower weight is seated firmly in its groove to ensure an accurate reading. Next, slowly slide the upper weight along its calibration bar by tapping it gently until the indicator point comes to a rest at the center of the balance area. Read the results in pounds and ounces while the infant is lying still. The scale indicates that Jonathan weighs 16 pounds and 8 ounces. Jot down this value or make a mental note of it. Return the upper and lower weights to their resting position and lock the scale. Next, the child's length is measured using the pediatric balance scale. To do this, place the vertex or very top of the infant's head against the headboard at the 0 mark. Ask the parent to hold the infant's head in this position. Straighten the infant's knees and place the soles of his feet firmly against the upright footboard. The footboard should be at a 90-degree or right angle to the measuring bar. Read the infant's length in inches to the nearest eighth of an inch from the measuring bar. The measuring bar indicates that Jonathan's length is 26 inches. Jot down this value or make a mental note of it. Gently remove the infant from the table and hand him to his parent. Return the headboard and footboard to their resting positions. The length of an infant can also be measured using a flexible tape measure. First, position the infant in a supine position on the examining table. Using a pen, mark a line on the paper protector at the vertex of the infant's head. Then straighten the infant's knees and mark another line on the paper at the sole of the infant's foot. Gently remove the infant from the table and hand him to his parent. Now, position the 0 mark of the tape measure on the first line and stretch it out to the second line. Read the infant's length in inches to the nearest eighth of an inch on the tape measure. As you can see, The tape measure also indicates that Jonathan's length is 26 inches. Jot down this value or make a mental note of it. Sanitize your hands and chart the results.